Other things to consider, I wanted to put it all together. A patient assessment form, basically, what it's going to look like. You're going to show up, you're going to introduce yourself. You need to demonstrate what you're about to do. You need to be sure you're at eye level when you're doing that, right? Talking to them. Show them what you're going to do. No surprises at all. You can't surprise with anything. Everything has to be explained up front. They may resist your contact. You may never be able to get a blood pressure or an oxygen saturation or a pulse on any of these people. And you know, if that's okay, then so be it. If you need it, then it may be time to use, like we were talking about with restraining people. May respond unusually to pain. We talked about the pain differences. Make sure they're okay with what you're about to do. Hey, can I put this blood pressure cuff on you? You know, let them tell you, yeah, that's okay. Let the caregiver ride in the back. We all know, we've all heard Hamilton County, and they're you know, they don't like to let people ride in the back, but you know, in this instance, it's okay. They can do that. We need to allow them to ride in the back. Physical exams should be done distal to proximal, so we start at the end and work our way in. Show me as opposed to tell me. If they have, say they tell you their arm's hurting, well, you got two arms and they cover a lot of distance, so you could physically touch it. Show me where, point to where it hurts. That may help to narrow your assessment down some, and then contact the hospital. That won't be us. You arrive on the scene and you find out that they've got somebody in handcuffs. Maybe they're in the prone position, right, with their hands behind their back. This can be particularly important if you're dealing with people with developmental and intellectual disabilities, because there are anatomical differences that we don't know about. They had a situation in Frederick County, Maryland. A gentleman named Robert Ethan Saylor was at the movie theater. He was a big fan of the military. He wanted to watch Zero Dark 30. Got there, watched the movie. He loved it, wanted to watch it again. Couldn't figure out why they wouldn't let him watch it again. They called the security, who were 3 off-duty police officers, came over. It ended up getting aggressive. They ended up arresting him, put him in handcuffs, laid him in the prone position. He laid there about 10 minutes, and they were doing CPR on him. Anatomical positional asphyxiation is what they call that. His anatomical differences, he didn't have the diaphragm to support his own weight to allow him to breathe, to move his chest muscles up and down. The chest walls, the trunk muscles are not as strong as they would be in someone else, in a typical person. So to lay there with his arms behind his back and try to support his own weight and then breathe at the same time, he wasn't able to do that. So that's the kind of thing that we have to watch. If you arrive on scene and you find someone like this that's in the prone position and you find out that they have developmental disability, or any time, we need to be monitoring their breathing. We need to make sure that we're not turning blue. We don't have any asphyxiation problems going on. So, and then remember, during if they have to be restrained at any time, you're more at risk to cause physical harm because of that pain tolerance that we talked about. So just keep that in mind. Some things to look for when we're in people's houses. This population is at greater risk for sexual abuse or any abuse than any other population. Be alert for signs of domestic abuse, belt marks, crates in the corner but no dog. You know, there's people that do this. It's a horrible, horrible thing to think about, but it's real, and we're in their home. We need to have that situational awareness, right? We need to be watching our surroundings and seeing what's going on. We don't need to have blinders on when we go in these houses. Bribing and manipulation, you know, we all use bribing and manipulation, but what are they using to bribe and manipulate? More than 90% of people with developmental disabilities will experience sexual abuse at some point in their lives. 49% will experience 10 or more abusive incidents. That's a scary, for someone who is raising a person with developmental disability, that's a scary, scary statistic. And that goes back to 1995. So, couldn't find anything any newer than that, but just keep that in mind. It's the point's not necessarily the numbers. The point is that, you know, this is a very, very real thing for some of these people. They're very easily manipulated and can be talked into just about anything. So keep that in mind. As firefighters, this is probably our biggest thing that we need to be on the lookout for. People who are raising kids who have developmental or intellectual disabilities have to do things that you're not going to recognize, that you don't understand, you've not ever seen before. And locked doors may be one of those things. If you get a call and you find out before you get on scene that this is someone with a developmental or an intellectual disability, we're not just going to take the irons to the front door and drop them. All right? We need to carry those throughout the whole entire house, because you may get there and you may find that these interior doors have been locked as well. You know, there's times when we have to lock people in rooms. You know, you've got to sleep, right? You can't just go to bed and pretend everything's fine. You know, that person may sneak out of their room, climb into a brother's room, you know, go off the top bunk, hurt them. We have to protect everyone, right? We don't just have to worry about the person with the disability. We have to protect the siblings that go along with that. So you may see extra door locks. You see, I've heard of people that just the door locks get higher as the kid gets taller. Locks on interior doors. That's very common to see. People who have to lock the doors, the interior doors. Barred windows. Plexiglass. Plexiglass between the seats, between two siblings in the back of a car. Or Lexan. Anybody have any dealings with Lexan? That's some show enough stuff. You know, breaking glass can be a stem for some people. And how many times are you going to fix that window before you realize that they're just going to break it again? So you replace that outside window with Lexan. I've heard of people shooting Lexan with 40 caliber hollow point bullets and it not penetrating the Lexan. So it may be a situation where it's easier to breach the wall beside the window than it is to go through the window. You can get through Lexan, sure, but it's going to take a minute. You may not have that minute to do it. So just keep all that in mind. Barred windows, you may see that just on this side. You know, a lot of these people, they talk about them being Houdinis. You know, they put all these precautions in place and they still manage to sneak out. And, you know, bolt risks or wanderers are a challenge. They can be a challenge to keep in and keep them protected. It's important to remember that some things may look suspicious that actually aren't. So, you know, it is absolutely okay to ask questions, but we need to do that without accusing, right? Show this real quick, and we'll talk about this. This is why we're here today, really. This happened in Knoxville in 2013, I think.
Report came in for a house fire. Also came in was a report that there was an autistic child inside the house. Firefighters advanced into the house knowing that there was a victim inside. One of the firefighters became trapped. Captain off of engine 17 advanced the line. It's a split foyer to that area where the stairs go up and down, scissor type stairs, and knock those flames down far enough to where the victim and the firefighter could be pulled away from the structure. The victim is a 25-year-old male, autistic. He was left inside the house. Everybody got out, but they could not find him. So, like I said, when we got here, we knew that we did have a victim inside the home, and our efforts were geared towards that first off.
Look at that road right there.
The fire, the family members reported that the fire, first seeing the fire in the basement portion of the house, and the flames extended from that point up into the upper portions of the house. Both of them were transported to UT Hospital. The victim for
that guy right there.
Smoke inhalation, the firefighter for smoke inhalation and minor burns.
That guy right there, I know we throw around the word hero a lot. That man right there is my hero. Knoxville Fire Department got the call. They told them that they found out that there was a child with autism inside. Y'all heard that was a child, right? That was a 25-year-old man once they got there. Knoxville Fire Department got on the scene in 2 minutes. 2-minute response time. You saw what that ground looked like, how icy that was. That in and of itself is pretty good, pretty amazing. But that man right there with 6 years in the department, he did what we all talk about we're willing to do, right? He went in there, found this man, picked up a 200-pound autistic man, and went to carry him out. While he was carrying him out, the fire came, cut off his pathway. He called for a mayday. The man was struggling, knocked his mask off. He never dropped the man, never put the man down. The captain from engine 17 came up, knocked the fire out. He carried that man down the steps, out the front door, and collapsed in the front yard. That's the kind of thing that keeps me awake at night. Those calls right there are what we have to worry about. That man saved that guy's life. No question about it. Absolutely saved his life. That's what we have to be prepared for. That's what we have to watch out for. Came in as an autistic kid, ended up being a 25-year-old man with autism. So keep that in mind. Adults can act like children. Even if they tell you it's a 25-year-old man, you may still find them hiding in closets, in beds, under in cabinets, closets. A lot of them are seeking that deep pressure. They'll slide in between the mattress and the box spring, seeking that deep pressure. So Don't just look on top of the mattress or under the mattress. You got to look between the mattresses as well. Use blankets, sheets, turnout coats, whatever you can for rescue. Try to tie those arms in and more easily manipulated like we talked about. Food. Food can be particularly challenging for some of these people. You may go in somebody's house and it look like a fire station kitchen with all the cabinets locked up, refrigerators locked up. And that would probably make you think, wow, they're withholding food from this person. This is an abusive situation, right? It's probably the first thing that would go through my mind. But there are medical conditions out there, such as Prader-Willi syndrome, where the person will just eat and eat and eat and eat. They can't stop themselves from eating. So the parent has to do these types of things to prevent that child from just eating themselves into oblivion, right? At the same time, you want to be on the lookout for things that may be abusive or neglectful. You may see things like stockpiled food or they may put food in their mouths and spit it out later because they don't know when their next meal is going to be. So just be looking for all that stuff. Food refusal and food lockers are not necessarily a sign of a bad parent. And we talked about pica earlier. This population, like we said, is at greater risk for choking than any others due to their sensory responses to food. Some things to remember, some accessories to remember. If you see these things on a call, you want to grab them. Like we said with the service dog, we use the leash, not the harness. Dogs go in the ambulance. There is an exception in the ADA that if the back of the ambulance is too crowded, that dog can ride in the passenger seat. And that is the only exception there when we're talking about the emergency scenes. So keep that in mind. Take the mobility equipment, if at all possible. Arrange for it to go if transport necessary. So if you pick up a guy off the side of the road who's in a wheelchair and you don't have any family there or whatever, he's going to go to the hospital. What are you going to do with that wheelchair? Yep. That's the key right there. Everybody doesn't know that. You can actually call CARTA. You can pick up your radio and call dispatch over the radio and tell them you need to get CARTA out here to pick up a wheelchair and take it to the hospital. You can get police officers, to put it in the trunk. It can't go in the ambulance. It legally can't go. If they were to get into an accident, it could become a projectile or whatever. So they can't take it in the ambulance. But we need to do something, right? Because that guy's going to get DC'd hopefully one day, and then what? What's he going to do? So keep that in mind, that wheelchair or those crutches or that cane or whatever their mobility equipment is needs to go with them. Communication books, devices may look like this. These are very important. Families work on these for years and years trying to get them exactly the way they want them. It could look like a book full of baseball cards, with the slots for the baseball cards that have different cards in them, may have Velcro on them, put sentences together, all that stuff. Just be looking for that stuff. How are they going to communicate with the doctors once they get to the hospital? This stuff is very expensive. You see these iPads here. An iPad in and of itself is what, $700? Some of this software, $1,500, $2,500. If there's any eye gaze technology involved, it can be $8,000 to $10,000. So just keep this in mind. These families work hard for this stuff, and they're very, very, very important. We need to be sure that this stuff goes with them. It's not going to do anybody any good at the junkyard when it goes to the car goes there. All right, seizures. We deal with seizures all the time. We go on seizure calls all the time. We need to find out, is this a one-time deal? Is this the first time they've ever had a seizure? Or is this something chronic? Have they already had 10 or 12 of these same exact seizures already today? Families deal with this all the time. It may not be necessary that they receive any treatment. It could be that you arrive on scene, the parent's already given Diastat. It's, up the nose, like kind of like our Narcan that we use, that they could squirt up the nose, an anticonvulsant to pull them out of this seizure before we even arrive on scene. We need to give them multiple attempts to prove that they're okay. I know that we're not the ones transporting, but you may be the advocate for that person. That hotshot medic may show up. Oh, they're not A&O, we need to take them, right? Well, it may be that they don't need to go. We need to give multiple attempts to prove okay. When we talked to the Epilepsy Foundation, the one thing that they wanted you guys to know is that their life is very expensive, and we don't need to add a $1,000 ambulance bill for something that they're already being treated for. So keep that in mind. Guardianship or conservatorship. We need to honor these if we ever see one. It's very hard to take someone's rights away from them, right? So if this person has gone through and they've done all this stuff, once they've reached the age of majority, this person is making the decisions for this person over here. As long as it's on that paper, that's the way it's got to be. Regardless of what the other person is saying, the person whose name is on it is going to be the one making those decisions for them. All right, just keep that in mind. It's going to be similar to like a DNR. You're going to see the paperwork. It's going to have the information. It'll be filled out, and you'll just follow those. It's very important that you follow that. We talked about the elopement a little bit, wanderers versus runners. They're across multiple diagnoses to and include dementia patients. We had one in Chickamauga not too long ago. Got out of the house, wandered down the street, got cold, came back, jiggled the doorknob a few times, and the guy shot him through the door. He was at the wrong house. So, there's a lot of disabilities that cause people to wander or run off. The runners have no sense of danger, mission driven. You'll hear Noah say, "Oh no, I forgot," and you better grab him because he's fixing to take off. He says it every single time. He thinks he's forgot something and he's going to bolt. He's going to take off. So you got to grab him before he takes off. The wanderers are not generally mission driven. They're just kind of wandering around looking, seeing what's going on. The runners are the greater risk of running into a house fire, and then the wanderers are sometimes harder to find. They're just as likely to climb a tree. How bad would that be? You're at the scene of a house fire and you didn't watch that kid or whoever that was wandering around, and now they've climbed a tree out in the backyard. So now we've got a USAR event on top of a house fire. It's a bad day. Bad day. Very important that we watch these guys. This is the most important slide of the whole day. Everybody make sure you see what we're looking at right here. All right? This is the thing. This is the ticket right here. 91% of people who wander with autism, who wander and die, drown. 91%. So if we're ever involved in a search and rescue type of situation, we get a call, "Hey, we've got a kid with autism down here. He's wandered off. His parents are looking for him." We're teaching people that they don't have to wait 24 hours to call 911 anymore. Those days are over. Call as soon as you find out. As soon as you realize that they're missing, call 911. That's what we're teaching people. So you may get this call to come down and help look for these people. We want to remember that they're very prone, that vestibular response, that floating sensation. If it feels good up to here, it'll feel even better over my head. Doesn't matter that it's not my pool, doesn't matter that it's 20 degrees, doesn't matter that it's a murky pond, none of that matters. Throw it all out the window. They don't care about any of that. So what are we going to do? We're going to arrive on the scene, establish command. We're going to pull up Google Earth on our map, on our phone, on whatever we got. Let's look at a 1 mile radius and let's start in the center. Every pool in the neighborhood, let's start sending people to them. Hey, send me a police car over here. Send engine 12 over here. Send engine 1 over here. Send whoever. Start sending them to these different addresses. Let's look for pools, ponds, creeks, lakes, whatever. And start looking there first. They pulled one out of the LA River not too long ago. He was up to his neck, 1 step away. I mean, they were there just in time. Had that guy, Indianapolis, the police officer, his body cam video is terrifying, where the little boy runs into the pond and he just keeps going. He calls him, "Hey, stop, come here." And the little boy just keeps going and off he goes into the water and disappears. And the police officer chases him and pulls him out. They're very much prone to water. That's where they're going to go. So keep in mind, if you're ever in a situation, check the water first. After we check the water, then we can start doing the arm-in-arm grid search, whatever it is, y'all, whatever we want to do. But it's imperative. We got 5, 6, 7 minutes, right? That's about what we've got. If they're out of the water, that's about how much time we got. So start with the water. I can't stress that enough. Understanding the caregivers. We wanted you guys to have an idea of what these caregivers go through. Basic responsibilities, the same things that everybody goes through, right? The same things that everybody that is raising kids go through. Then we have comorbidities that go along with these diagnoses. People who have certain diagnoses are more prone to have a comorbidity. I told you Emily has 27 diagnoses. Those are comorbidities that go along with her spina bifida and her hydrocephalus. So there's a huge, the possibilities are endless. Everyday illnesses can be life-threatening. We've all had that call, difficulty breathing, child is congested, whatever, and we're like, what in the world? I can't believe we're going on this. This is crazy. But we get there and we find out that this person has Down syndrome, and last time they had a runny nose like this, they ended up in the hospital with pneumonia for 2 weeks. Well, it just got real, right? That everyday illness for your child can be life or death threatening for someone in the special needs community. So keep that in mind. That goes to the next one. Listen to the caregiver. I can't tell you how important that is. It may be, now there's a chance that, this is a group home and they've just met that person, right? They may not know any more about them than we do. But there's a chance that, if this is a parent or whoever, they're going to know more about that person than their doctors do, right? They've Googled, MD'd, all that stuff, and they've listened to all the doctors and got all the information. They know all the comorbidities and everything that goes along with it. So keep that in mind. It's very important that we listen to the caregiver if the caregiver is the person that's been with them for, at least an extended period of time. Scatter skills may be present as being able to make decisions and not really being able to. Noah will trick you. Noah will make you think that he is a typical person, that he has typical abilities. But you have to, I caught myself doing it the other day. Is he really saying what he means, or is he repeating something that he's heard? Is he saying something that he knows what he's talking about, or does he not? It's hard to understand sometimes, and it's going to be impossible for you to understand because you don't know these people. That's why it's so important to listen to the caregiver. Unreliable memory. I told you Emily had 27 diagnoses. She's had 30 surgeries. You think you could remember 30 surgeries over the last 17 years in order? Whenever you sit down and you go, okay, what's her medical history look like? And then she goes, well, I know when she was born she had this, but, you may be able to remember the first and the last, but all that stuff in the middle, you're going to have notes or something. So just keep in mind that, don't think that this is a bad person because they can't remember all that stuff. It just may be that there's so much that it's hard to remember. Guilt and shame, something you would never associate with being, a caregiver or someone that takes care of someone with special needs. But I told you we spend $300 a month for Noah's lunch. ABA therapy in the state of Tennessee is not required to be paid for by insurance. $60 an hour. They want to do 4 hours a week. That's $1,000 a month. Right? Schools, way more than $1,000 a month. Therapies, we do 5 therapies with co-pays every time. So there's a lot of money there. There's a lot of things that people have to do to just get by with this. So then you have to say, well, now I've got this car that I could sell, and then we could do a little bit more. Or I've got this. Does he need to do 6 therapies a week? What else can we do? Are we doing everything? Is this the right person to be treating him? So there's so much that goes into, are we doing the right thing, right? There's no manual for any of us, but just imagine if you had all of this other stuff to compound that decisions that you had to make. It's very scary, that you have to worry about, are we doing the best thing? Is everything working the way that it should? Lack of resources and support. I tell people all the time that raising a child with special needs is like living on an island because nobody gets it. You'll find other autism parents that get it, but that's about it. Nobody understands why your kid is over here screaming and crying and you're not busting their butt, right? Because that's what everybody expects. So lack of resources and support. Modified pain responses, we talked about that. Medical team that may or may not be helpful. They're probably not calling other doctors saying, hey, I put Emily on a new medication today. You might want to watch out for such and such side effects. That's up to the parents. That's up to the caregivers to take care of. Side effects of medications. So we have the polypharmacy effect. We just tried this new medication, now they're not sleeping at night. So now we got to give them something to make them sleep at night. Well, now they don't. Now they're falling asleep in class, so we have to give them this. Well, that makes them not eat anymore. So you see, it can snowball, if you let it. So you have to be careful of all this stuff that goes along with the medications. Lack of trust in the medical community, we talked a little bit about that. Many function with PTSD themselves, and then all function through exhaustion. Every single night when we go to bed, I know that Noah is going to get up in the middle of the night and he's going to climb in the bed with us every single night. And sometimes he goes back to sleep, sometimes he gets his iPad out. You can hear the helicopters, starting up, spooling up on his, on the iPad next to me at 3 o'clock in the morning because he's up for the day. But I have to do that. I have to let him stay there with us because what happens if I send him back to his room and he goes in there and he gets bored, so he goes in the living room. And he goes in the living room and he gets bored, and then he slides his chair over to the door and he unlocks the door, and out he goes. So in order for us to know that he's safe, we just let him come in the bed with us. That's how we do it. So that's another one of the things we hope the dog's going to help with. But we're always tired because of that, because he's always constantly waking us up. So here's what we're doing. Some more things that we're doing in Chattanooga. We're doing this, the SNAP stickers. Those are hot off the presses today. So we're going to start passing these out as soon as possible. We're working on having families input their information into the 911 system. Let the 911 system know that they have somebody there with special needs, so that when you get the call, you'll know in advance that this is somebody who has special needs. We're doing these contact forms. If you see that sticker on the back of a car, you will get up there and you realize that the parent is unconscious or whatever. There's somebody in the back who has special needs. Go to the glove box. Look for this form. Have all the information about that person that you need. If you don't recognize this, then you don't ride the seat, right? This is our system. This is what we use. This is what Hamilton County EMS, Hamilton County Sheriff's Department, Chattanooga Police Department, and Chattanooga Fire Department, what we all use. So you see this tab right here? This is the caution tab. It's going to look like this on a normal. If I hadn't clicked on it, that's the color it would be. You can see this is my house right here. Every time you get a call, if you're riding that seat, you need to be clicking that caution tab. You need to be looking at that caution tab and seeing what it was. We had one the other day that said patient is known to be hostile with first responders. That's a pretty good tidbit to have when you respond into this house, right? You get police involved. So this is where the information for special needs is going to be at. And this is becoming more and more popular. We're getting out to more and more people. Everybody that hears it wants to do it, and so they are. And another thing that you can look for here is group homes. We're putting group homes in. I've already got a list of 90 group homes that I've sent over to the 911 system that they're putting in. So we can start looking for these to start showing up on our CAD system. So click on that caution tab and find out what's going on at that house. We're trying to get these people, trying to get them to come into the fire stations so that you guys can meet them and get to know them before it becomes an emergency situation. Make you not the scary part of it, right? Make you not a stranger anymore. And we want to pre-plan. We want to pre-plan group homes. That's another thing that we're trying to get people to do is pre-plan these group homes. We're going to start getting that information out there as well. So you guys get in these houses and get to know these people and take some of the mystery out of special needs. Remember to look for the stickers and the bios on the homes and vehicles. Send families to Lifeline right now. That's the only place to get it, right? LifelineFamilies.org. Send them to us. Call me. Send them to me. Send me an email. We'll get them some stickers. If you work somewhere where you think might benefit from this training, please, by all means, recommend it to them. Have them send me an email. I think I've proved that I'll go anywhere. You know, I've been doing it all over the place. I'm doing it tomorrow at Chattanooga State. So we'll go anywhere. All right, thank you.